Hey everybody, we are so glad you're tuning back into this podcast. You're not going to want to miss it today. Beth and I are at the amazing Tamaya Pueblo at the 24th annual ACEP conference. And we're also here today with our colleague and friend, Dr. Greg Brown.
Hi.
And today we're going to be talking about addictions and CPTSD. But first, I just want to give you a shout out for listening. Thank you very much. We've had about 6,000 listens to our work, which is amazing and good. Thank you very much. And if you are able to like this, subscribe, or write a review, we'd really appreciate it. That will help us keep going and get guests on that we know you want to hear from. See you inside.
Okay, welcome everyone to the CPTSD podcast. I am still Beth Pace, licensed professional counselor supervisor here in New Mexico with like some of my professional lights of my life, Tab the Bird Weaver and Dr. Greg Brown. Tab needs no introduction, but today we are also joined by our colleague from the Advanced Integrative Therapy Institute Research Committee, Dr. Greg Brown. If you will, Greg, introduce yourself. What do you do? Where are you from? And then, if you would, maybe the two of you guys could, in brief, talk a little bit about the research that you presented on just a couple of days ago, just so people know, because we talk about AIT a lot on our podcast. And we're at a point still where we're like, look it up on the website, see if there's an AIT practitioner in your area. But it's also so nice to be able to say that the research shows that this clinical intervention is extremely effective. Yeah. So I talked a lot. Let me circle back to introduce yourself.
Okay.
Tell us about the research.
Okay. So I was born. I have a background. I have a Bachelor of Arts in Psychology from Oberlin College. Then went to medical school. Then went to a psychiatry residency at Einstein in Philadelphia, and then a forensic psychiatric fellowship in University of Rochester in New York. Finished all that stuff up in 1996 and moved out to Nevada. And after getting to Nevada, I have created the psychiatry residency training program there, where I've been the residency director since 2004. Now, newly a professor of psychiatry as opposed to an associate professor, whatever that means. I work at the school about half-time, and then I have a private practice half-time, and in my private practice I do half medical legal work for the courts, attorneys, insurance companies, or anyone else who cares to pay. And the other half-time is a clinical practice dealing a lot with depression, anxiety, post-traumatic stress disorder, and other kinds of trauma and other issues that people bring forth. So I do a little bit of everything, multiple hats, stay busy.
Yes. Welcome. We are so happy to have. Will, you've been on our books for a couple of months, and so now we're like really here. We're living in this moment. I am so happy. Why don't you guys?
And the pandemic thing. None of the three of us have met each other for real before. We've been looking at each other on Zoom for, a year and a half or something, or a year? Anyway. So it's just been so cool to meet everybody and see each other face to face.
And like sort of trying to prepare each other for I'm gonna hug you, I am a hugger, I'm gonna bear hug you. I didn't tell you that, but I did it. So
watch out.
Yeah, right. Surprise. But also on Thursday, you guys gave a presentation at the research symposium. So Tab said ACEP, this is the Association for Comprehensive Energy Psychology's annual conference. And both Tab and Greg got accepted to the research symposium to talk a little bit about the research they have done over the past year in advanced integrative therapy. So why don't you guys tell us a little bit about how that went and what you said. What's the research show?
All right. Okay.
Go for it.
I was going to go to you first, but here we are. So what I presented was an individual case study that I conducted, and which was published in Energy Psychology Journal, which is peer-reviewed, and in our industry that's important because we think that the input and gatekeeping of other colleagues is crucial to make sure that our research is sound and that we can make appropriate claims. So the nuts and bolts of what I presented was a total of 9 sessions. 5 of those were within the study, 2 were follow-ups because the client felt they needed a little bit more connection for that continuity of care and symptom management. Bottom line, this client went from qualifying for a diagnosis of PTSD and CPTSD to not meeting criteria for that at all in 3 sessions. That's amazing work.
Absolutely.
Yeah.
Astounding.
Yes, it is.
And other research in energy psychology like EFT and TFT, which is emotional freedom technique, and also I completely
Thought
lost-
field
Thought
therapy.
field. There we go. I'm like, Callahan was the thing that was sticking in my head. The creator of that thought field therapy show similar results.
Okay.
But those are pretty fast. Yeah.
And what's sort of amazing, at least from a psychiatric perspective, is if you talk to many of my colleagues over the course of decades, they would just say, once you've got it, it's there. There's no way to unhook the amygdala. There's no way to unhook the emotional response. Just take Zoloft the rest of your life and cross your fingers and hope for the best. And this is just such groundbreaking stuff, is to see a clinician, a wonderful clinician who did the extra work of doing all of these scales, and a client who was willing to tolerate filling them out.
Right.
On the
Yes.
flip side, but actually demonstrating that this intervention eliminated the diagnosis in 3 sessions is utterly groundbreaking.
Yeah, and thank you for that. And I had contact with this study participant just a couple of weeks ago, and they still remain below threshold for, they're still not diagnosable. But in real life, it is really amazing. In real life, what this meant for the client, and why I'm saying this is so that our listeners understand, how does that translate? Right, and so for her, the fibromyalgia pain went down. That was important. It's not even something that was a key part of our lost it study. There we go. But we tracked it anyway because it was important to her. But she had an experience where the electric company was going to come out and turn off her bill because she had forgotten to pay it, so they're going to turn off her power.
Oh.
And she saw them outside, and she let me know that previously this would have put her in bed for 3 weeks. The shame would lead to a fibromyalgia flare, would lead to more shame, and on and on and on. And they called and said, I just want you to know, I just got online and paid the bill. Without any of that 3-week drama.
Wow.
Without any of that fibromyalgia pain. I'm just like, whoopsie. Instead of, oh my God, I'm a pile of poo.
Yeah.
I think I'm quoting directly right there. But real life impact. Real life impact. And you did a wonderful presentation on kind of a summary of the research and what we've experienced.
Well,
I'd love to hear,
Well, we wanted to begin looking at AIT because I've had some incredible experiences with clients in my practice using AIT. I'm one of those psychiatrists who still does therapy, so if that wasn't obvious already. And I couldn't explain why it was working so well. And just as Tabitha described, people would come in after a relatively few sessions, after having gone to therapy for years before, and not stuff on the quote treatment plan, although I hate that word, but life changes would have occurred that were just dramatic and not something we would have written down. It was like, oh my God, that's like big. People talking to their family after a decade, just spontaneously picking up the phone with, it's like, wow, who would have thought? Anyway, so there is not yet a lot of research present on AIT, unfortunately, but we're sort of trying to get some done. And Tabitha did a fantastic job with the case study. Beth has also had something authored as well. But this study that I presented here, we did a survey of AIT therapists worldwide, and just ask them a few questions about a case of their choosing to see how intense the symptoms were when the person entered treatment, and then after one session, looking at the intensity of the symptoms, how much it came down in one session, and whether or not the emotion went away. If a secondary emotion came up, did it go away too? If there was a physical sensation in the body somewhere, did that clear in the same session? If there was another physical sensation that took its place, did that clear? And you're just sort of, and this is also in a write-up form. It's in being considered for energy psychology as well, which is a peer-reviewed journal, as Tabitha pointed out. So we're crossing our fingers and hoping, but. The people started, we use a scale of severity in energy psychology, and I guess all the rest of medicine for that matter, called a SUDS. It goes from 0 to 10, and you've probably talked to doctors or therapists, and they say, how bad is that on a 0 to 10 scale? And so anyway, the average starting point for these folks was 8 out of 10. So they weren't coming into their therapist for mild stuff. These were sessions that were dealing with relatively heavy stuff. And at the end of the session, before walking out at the end of the hour, it was down to a 0 or 1 in 80% of cases.
That's right.
And also that 80% carried across with regards to clearing the physical sensations, both a primary and a secondary, and it almost carried across with emotions. It was a 66% cleared both primary and the secondary emotion. I mean, all of them cleared the primary emotion for the most part, but that is an astounding finding.
Yeah.
Now, obviously, these are therapists reporting on patients. Perhaps they overestimated results, or maybe they picked their very best one, the cherry picking phenomenon. All of that being potentially true, these are still astounding results, because from traditional based therapies where you yak and talk and discuss beliefs and whatever endlessly till the end of time, you would not see this kind of change in a year's work. And I can attest to that because I used to do more traditional therapy.
Right.
It is just amazing. And so I have to give great thanks and honor to AITI, who gave us the names of the people who had done training with them, and great honor and thanks to the people who took the time to fill out a survey, because we all know everyone gets too many damn surveys in their email. It was like, oh my God, another stupid survey. But anyway, people did, and we got a large enough pool to really get some meaningful results. And I'm very thankful to all of those people who participated, and to our School of Medicine, who provided the statistical support and helped create all of that infrastructure of which I know nothing. And anyway, it was a lot of fun to do, fun to write up, and we're hoping to do a randomized clinical trial. Going to put that up to the IRB for approval in the next few weeks, so we'll see how it goes.
Cool. Thank you so much for doing that research.
Oh, you're welcome.
I think he almost said it's fun.
Yeah, I did my entire career with the utter plan of never doing research. And I was like, I'm going to be a clinician, I can teach, I can do all this other stuff, but I'm not doing research. It's too much of a pain in the ass. So this was just a lot of fun.
I knew you were going to say it was fun.
Once we got into it, and I had some help from a level of infrastructure to do like statistics, which I don't really, it actually ended up being kind of fun to say, what is this going to show? It's like a detective story. Because, I don't know, I may be changed.
He may be changed, ladies and gentlemen. Shout out to both of you guys. I'm really happy for you. Sorry that I missed that, but hopefully we'll be able to get to watch the recording. So what we're going to talk about today on the podcast, recognizing that we've probably only got about 45 minutes together, I care a lot about keeping the time. Like a lot. It feels really good for me to keep the time. But so what I've had a couple of requests. We've had a couple of requests through email to talk about addiction related to complex post-traumatic stress disorder. So because there's three of us, usually what we decide to do is that one of us is going to be like fielding or like asking the questions and then like getting the responses. And because we're not on Zoom, I don't have to be like, like, which is usually what happens when I'm like, now I need to talk. We're gonna just have a conversation, but I'm gonna ask you guys some questions, especially related to addiction and trauma and how those two things go together, like peanut butter and jelly. But let's start with the most basic question in your clinical opinion or in your experience. and Tab, we'll start with you. How does a traumatic childhood set you up for an addiction in present day? And when we say addiction, I just want to stop and be clear. Let's raise the bottom a little bit. We're not talking about a $300 a day heroin habit.
Right.
We're talking about disappearing into work. We're talking about certainly any behavior that you feel compelled to do, even when sometimes you're like, gosh, this isn't a great idea, or something that you're continuing to do despite increasingly negative consequences. So when I say raise the bottom, I mean if you're out there and you're like, well, I don't have a drug problem, I don't have a drinking problem, so clearly this episode is not for me. Fear not, folks.
Right.
This episode's for you.
Something's
if it's
in
for
there.
me, which it is, then it might be for you too. So Tab, let's start with you. How do you, in your experience, in your training, in your opinion, how does a traumatic childhood or traumatic events set you up for an addiction in present day?
Yeah, so I can think of two main things. The first is how your brain is actually structured as your developmenting is impacted by trauma. And the other is then the trauma transmission of the people around you. And I'll talk more about that.
Yeah.
But the trauma transmission and the dysfunctional coping skills that you learn from the people who are helping to care for you. So when we are raised in a traumatic environment, and remember please that trauma involves neglect too. Because we tend to think of abuse when that comes up.
Right.
But neglect is definitely very traumatizing. When we are raised and develop in that kind of soup, we end up having our brain wired for lack of safety and security and for over-patterning the chaos, meaning trying to figure out what is going on in your environment all the time. And so we become very good at finding patterns. We're good humans in that way. Right, but we can then continue to over-find patterns as adults where it might be something inside of us instead of inside the environment that needs to shift. But going back to the brain development piece, when we are wired to have a lack of security and a lack of safety, we really become experts at getting our needs met however we can. Right? And so that can be, I'm going to use negative kind of language right now because that's how we are experienced frequently as manipulative, controlling, demanding, or we disappear. Right? Or we're either in a relationship or from a relationship, right? But there's a lot of relational issues that also come from that development in the soup of trauma that are really painful, first of all, and make it difficult to get help down the road. So I'm kind of wandering off in the weeds, so I'm going to tighten it up a little bit and say, when you're raised and your brain is always looking at how you can be safe and get your needs met, and the people around you are showing you how to do that in ways that are not healthful, like using substances or workaholism, or maybe they care about the gym more than they care about you. I know, exercise can be in there too.
Oh, no.
I know it. Well, guess what? Those things become the way we do it.
Yeah.
And it's so deep within us that we don't even know we're viewing life from a belief structure. It's just reality.
Right.
Right? And so we also end up feeling like the world isn't safe and we're overstimulated a lot. What are your thoughts, Greg? I'm going to pinch it off there. Otherwise, just keep going.
I'm going to make a really quick recommendation to anyone who's hearing this, because I have to give sincere thanks to a hypnotherapist I just took a course from. His name is Calvin Banyan, and the book is called The Secret Language of Feelings, which you can get from Amazon. My answer is the same as it would have been before this course, but I would have said it using 10,000 words. And this book actually is for the lay public. It is so readable, and it's a 1, 2, 3, and so I have modified my language to not take 10,000 words, which is probably great for everybody. And that is, Cal says, and I agree, that what happens is a primary emotion arises, whether it be anger, fear, sadness, something that would put a frown on your face, or a metaphorical frown. And rather than dealing with that emotion directly, because it sends people who have already been traumatized into complete overdrive.
Yeah, right. Yeah.
we find something in this universe that distracts us.
Yes.
Doesn't matter what it is. It could
Right.
it could be the gym.
Yeah.
It doesn't tend to be for me, but it could be the gym. It could be eating. It could be using drugs or alcohol. It doesn't matter.
The
It's just-
internet, Instagram,
Yeah.
listen.
Yeah, TikTok. Okay, there you go. So you get and you do this, and while you do it, it distracts. The primary feeling goes down because you're able to ignore it, and so it was effective. The only problem, it was only effective as long as you were doing it, because then the primary feeling comes back.
Yeah.
And then you already have the answer. Distract.
Right.
And you distract with that. And then if you continue doing that cycle over and over, then you get another emotion, which is frustration. Why isn't this working? Well, now you're frustrated, so how do you deal with the frustration? Well, you distract
Right.
with the same thing.
Yeah.
And then he talks about this now spiraling into more of a depression, where
Yeah.
now, since the distractor didn't work for either the main problem or the frustration, now you go into a withdrawal mode.
Yeah.
I can't deal with it. I just need to step back. And so, as he pointed out, if you can just get back to that primary emotion, acknowledge it and do something with it, then you can begin to break this distraction cycle. And that is the most efficient way I have ever heard of dealing with this, really. I mean,
Yeah.
that's
Super great.
That's just really cool. So I would recommend that book, really. It's eye-opening for anyone, and it also has cool shortcuts for each emotion.
Nice.
To say, if you have this emotion, it means blah. So like
Okay.
if you're feeling anger, then maybe you're perceiving something in the world to be unfair.
Right.
As an
Yeah.
example. So then it's a 3-step thing to deal with it. But anyway, I don't want to advertise his book too much, but nevertheless, it's just so understandable. I've started giving it to most of my patients because it gives them a tool set.
I can see where if you continued down that spiral, you would start hitting larger problems like hopelessness and,
Yes.
and real clinical depression, right? Not to mention the consequences. Let's say that your distraction is gambling. That comes with a bunch of consequences down the road, right?
Absolutely.
So I really like the way that you summarized that. That was great.
Okay.
Yeah. So what do you
Thanks,
think?
Tab. Yeah, so how does a traumatic childhood set you up for an addiction in present day? When Tab said, as the reminder that like your parents could have been taking you to all of your extracurricular activities and you were still being emotionally neglected.
Right.
So one of the things that can be so tough about naming neglect or like naming complex trauma is you're getting your financial needs met. Right? You're like, there's always food in the house. Or if you already know that there was neglect and trauma in your childhood, then like you are not necessarily who I'm speaking to. But for all those people who are like, what's the deal here? What is going on? Confusion.
You have a roof over your head.
Right. What do you have to
Right.
complain about? So that confusion is actually a really huge part of your own behavior being inscrutable to you, because you're like, why am I doing this? And if every time you ever did anything to cope and somebody told you that it was wrong, you're also kind of like in this pattern of like feeling that kind of no matter what you do is wrong. So we get wired for chaos to the degree that adult children of alcoholics and other family dysfunction actually describes this as like the internal medicine cabinet of hooking into your own adrenaline. Right, you can get addicted to adrenaline, the thrill of riding your bike down a hill without your feet on the pedals. Like that's adrenaline. But then so is like lying and getting away with it. So are like some of these other things that as children we maybe are like patterning the behavior because we're watching the adults around us do that too. So there's a couple other things I want to bring up because Greg was talking
One other
about.
little thing, and that is, I would just say a lot of the kernels of the behavior that start in childhood are always, or virtually always, protective
Yes.
and safe
Yes.
and useful
Yes.
for a 4-year-old child.
Right.
Yes.
Absolutely.
They just cease to work when you're 40.
Right.
Tantrums don't work as well at 40 as when you're 4.
Yeah.
It depends on how scary you are,
I suppose
right?
that's
So
true.
like if you're big and scary and you're the person in your house with the anger problem, it works, but you're not actually getting authentic acquiescence where someone's like, let's compromise. People are afraid of you and they're doing what you, so like low key, if you're 40 and anger is working for you and you're like, but I don't know why this isn't working for me at my job, or like when I get pulled over, right? So like
a higher order
right,
level
it
of work.
stops, right. And so the other thing about like what you're talking about is that like there's a primary emotion, and then a lot of times the secondary emotion that we experience are things like shame.
Yeah.
You can heap hot coals of shame on top of yourself. And who taught you how to talk that way to yourself? Most of the time, it was your caregivers.
Yep.
And so emotional neglect is complicated. It looks complicated. That's why the C in front of PTSD is complex. But also, I want to talk about how if nobody, right, so when Tab talked about it before, if people are showing you the kind of coping strategies that worked for them because that's what they got taught from their parents, no one teaches you the capacity to tolerate the distress of that emotion. It has a beginning, a middle, and an end. So no one is ever like, okay, wow, your cookie fell icing down on the floor. I can see this is the worst day of your life, right? Because if you're free, you've only been alive for like how many days? It could literally be the worst day of your life. But if someone's like, oh, stop, there's more cookies right over here, instead of being like, okay, I see you're sad, little guy. Let's ride the whole wave of your emotional life of the beginning, the middle, and the end. What we're not teaching kids then is the capacity to tolerate distress. So then when you get older and you experience more distress, you don't have the capacity to tolerate that distress. And substances, numbing, dissociation, sugar, salt, and fat, you name it, those all work a treat for soothing in the moment without having to ride that wave of your emotions. And so when people come to us and they are, talk about like frustrated and confused by their own behavior, I know I should stop doing this, but I don't have the ability to do that. The withdrawal or the shame, now I don't ask for help anymore because everybody's looking at me like, why don't you stop doing it? That's easy for me.
What's wrong with you?
And you're like, oh, cool. So just like let me not tell anybody about it anymore. The other thing I want to just add to like how does a traumatic childhood set you up for an addiction in present day? Secrecy.
Yes.
Secrecy. You got to
Really?
keep secrets to make it in a dysfunctional childhood.
You sure do.
What's your emotional life like? I'm fine. So if your parents like, why did you lie? And you're like, cause I'm afraid of you. That would be the truth. That is not the right answer. That's not the right answer, folks.
No.
So if you're like, why did you lie? And you're like, cause I'm bad. And your parents like, bingo, nailed it. At least we're all on the same page.
And if you go with I don't know, now you're mad and stupid.
Yeah, right. So
Right.
hiding your emotional life from others, and then you notice that it kind of works, and then hiding your emotional life from yourself kind of works. For how long, right? I usually end up seeing people in my practice at about 27, 28 years old, Saturn's return, or like when you're the last part of your brain is finally done developing and you're sort of sitting with who you are and taking stock of it and going, is this really what I want to bring into my 30s, 40s, 50s? Is this what I want to be like giving to my kids? And I might have lost the thread.
We'll find it.
All right, there was one more thing I wanted to say. It must not be important or it'll come back around. There it is. Gabor Mate talks about that when, if you don't know you're carrying trauma in your body, if you don't know that because everyone around you has said, don't you have a lot to be grateful for?
Yeah.
Don't you know how many starving children aren't being forced to sit at the table until everything on their plate is finished? Then the first time you ever try a substance, you're not getting like a euphoric effect like another child might be getting. You're getting a euphoric effect and an analgesic effect.
Right.
You're getting pain relief and feel-good chemicals. There's nothing like it. So people say like the first time they use opiates and they go, is this what feeling normal feels like?
Yep.
Oh my God. Why didn't anybody tell me? I'm gonna do this more.
Say, just box up that plate and send it on over. There's your power statement.
Yeah. And so it's devastating to struggle with addictive behavior because if you don't know why you're doing it, you can't explain it to someone else. And so I'm also very interested because you were talking about protective, you're talking about safety, we're talking about secrecy, not because you're bad, but because you're taking good care of yourself. Then why a self-compassion approach to treating addiction from your clinical opinions versus that kind of old school, we got to break you down into a puddle of goo and then build you back up as a better person? This is maybe 30, 40 years ago, and some of those places where you would go and get treatment, and what it really was you don't know anything, your own best thinking is trash. This idea that who you are is not ever going to work, which is why we've got to crush that and then rebuild you in the image of functioning for survival of whoever that is. So 6 systems can be we'll heal you. All you got to do is give your power up and fit a certain mold. Why self-compassion instead of that break you down kind of model?
Would you like to go, Greg?
Well, I think Penn and Teller, who I was a big fan of on their show, found the original documents from AA and the original response rates or whatever, and it topped out at 5%. And so that would be suggestive that the breakdown and rebuild model is not terribly clinically effective.
Okay.
It also really drives a lot of people away from treatment because they either can't comply or they won't comply, whatever. And that's the language. It really is a compliance-based
It is a
language,
compliance.
which makes me I can't stand the word comply, so why would someone else like it?
Yeah.
So I think meeting people where they are means opening your heart to where they are,
Right.
and allowing this interaction of self-compassion. And as trauma gets cleared effectively, then the need for the substances begins to drop off naturally. So it doesn't have to be a fight. It doesn't have to be this internal struggle. It's just I don't feel like I need so much of X anymore. And doing it that way so that the outcome is almost naturalistic as opposed to an internal struggle is, by its very nature, I think going to be more successful as a journey.
Yeah.
So that's the way I would look at that.
I completely agree. And I would just say, from my direct, simplistic approach, you've been beating the crap out of yourself already all these years. That hasn't worked.
Yeah, that's
right.
Yes,
and the very
absolutely.
thing that we need, especially with developmental trauma in our history, is validation and compassion. It's the thing we didn't get. Mirroring, awareness, and so I think where the complexity comes is learning how to be abstinent enough or safe enough with whatever you're using that you can learn how to tolerate that bell you were talking about, that distress tolerance, and come back down, right? And so I really would encourage everybody out there, I'm looking in the camera as much as I can, that if you are struggling with any kind of addiction, be mindful about how much that addiction is currently harming you, right? And that will help you understand where you can maybe get some harm reduction. For example, some drugs kill you faster than others. just that kind of awareness, you know.
There was a really cool chapter in a book, which is it's fascinating, but essentially unreadable. It's called The Neurophysics of Human Behavior, but they really brought up an incredible model for addiction, I thought. And they said, make a list, when I'm happy, I do X, and make these, balloon bubbles or whatever. And if I'm happy, I do the addictive behavior. If I'm unhappy, if I'm mad, if every input leads to that behavior, that's a pretty good sign you may have an addiction.
Yeah.
Whereas if different emotions lead to different behaviors, then it's probably not so much.
Indicative of a life in balance. Okay.
And I thought it was a fascinating way to look at
It's
it. I've
really
never
great. It's really great. I say that to my clients this way: have a bad day, have a beer; have a good day, have a beer. There's something going on there.
Celebrate, have a beer.
Exactly.
Yeah.
So.
Yeah.
But there is a little delicacy in figuring out how to continue an activity enough that you're okay, because it has been protecting you, even if it's not working, while you learn to tolerate the distress of the emotion.
Right.
That is why we advocate heavily that self-help books are great, but therapy is really where you need to be to heal CPTSD, because we just need that extra support and that, I think, the mirror, frankly.
So why self-compassion versus like breaking you down to sort of fit into society? Listen, the systems are the problem, okay? So if it's concentric circles of the same dysfunctional system, it isn't about fitting into the system better. The system is deeply flawed. So, thinking about, and maybe I've said this on the podcast before, what's the difference between an external locus of control and an internal locus of control? And putting a substance into your body or engaging in some sort of addictive behavior is an insufficient proxy for an internal sense of safety.
Correct.
And so, why self-compassion? What Tabitha just said, if you didn't get compassion in your childhood from your caregivers, you are starving for it. And external substances putting into your body are an insufficient proxy for that wound. You can numb the wound like that, but you can't heal it. And so learning self-compassion is really about like learning how to reparent yourself the way that you actually needed. And so, parts work, internal family systems, because there are some 12-step mutual support programs, folks, that are all about the tenderness approach.
Oh, yes.
And one of them
Absolutely.
is like what I keep referencing, which is adult children of alcoholics, other dysfunctional families. So then learning how to reparent yourself with gentleness and love. An example, like a case example in brief, someone was talking to me about some very addictive behavior that they were engaging in, and we sort of just like stopped in this moment in time, and I was like, and if you were watching you at 14 engage in this set of behaviors, how would you be like parenting or caring for that 14-year-old? And they went, I'd feel pretty disgusted by them, and then I would probably just like kind of shrug my shoulders and be like, I trust you to figure this out. And I was like, we were on Zoom, we were on a telehealth call, and I pulled up a bunch of stock photos of 14-year-olds and was like, can you look at that child for a second and tell me whether or not that adolescent looks equipped to just quote unquote figure it out by themselves? And it was really painful to stop for a moment and go, I'm still shaming myself when I'm still beating myself up. So self-compassion isn't like read a self-help book.
Right.
Somebody be like, why don't you just be a little nicer to yourself? Whoa. That's why we'll get to why we think energy psychology is more transformative than talk therapy. But if there's a part of you that can say to your therapist, that's a very good point. Oh yes, I can really see where you're coming from, because people pleasing is part of your stuff,
Right.
But there's still some part of you in there that's like, but that's not going to work for you because you're a total piece of garbage. We've got to find that voice. Why self-compassion? I will ask my clients who are coming to me with addictions, I'll say, do you want to work on getting the substance use under control? I've got tools for that. EMDR has a particular like bridging technique. What's the sensation you're feeling right before you're about to engage in the behavior, the one that you're trying to avoid? Let's trace that down and back to the very first time you ever felt it.
Yeah.
Treat the trauma there, and then see what happens to the need to engage in that pattern in your present day. It's incredible. But when I ask someone, you want to work on cutting the substances down, or do you want to work on building the self-esteem and the self-compassion up, and then seeing what that does with your relationship with substances? 9 times out of 10, the fear says, I can't go near cutting back. So we work on building up the esteem and the regard, and then over the course of a couple of years with someone, they are now abstinent from alcohol and have been abstinent from marijuana for like 2 months. Which, like, when they first came to me, they were drinking over 15 ounces of whiskey a night. So,
wow.
Yeah.
That's
So
a lot of whiskey.
That's a lot of whiskey. And it turns out after about like 10 ounces, no matter how much you drink, it's not going to make you any more drunk than you are at that point. So why self-compassion is because controlling your behavior is what has been done to you your entire
That's
life.
right.
Why more of that? It does not work. Or controlling your behavior to fit into a sick system is desperately sad.
The one thing I have to add as a closet Jungian
Go on.
is that
You're out now, Greg.
in the example that you as the example that you just described, since the compassion is not able to be internalized, it's then projected onto the world or the substance. And so the belief is I have to have this substance or this behavior in order to activate the compassion, rather than realizing that it's actually all inside.
Right.
It's just projected out. And I think that's another interesting way to look at it.
Right. The difference between, that external locus of control, something else makes me feel this way, versus that internal locus of control, which is that I can tap into my own inner resources. And I think that's the last thing I'll say before we jump to the next question is, if you had parents who were terrified of their own depth, no one will have taught you how to go inside.
Yeah.
No one will have taught you how to explore your own internal resources.
Yeah.
And so it's less scary to snake belly crawl through gunfire to get to your dope dealer's house than it is to sit silently and be with whatever comes up in your own internal life. I've had people say almost exactly that.
Mm-hmm.
Meditation gives me panic attacks, but when I'm like ripping and running trying to get a 40 bag of dope, I've never felt more alive. Okay, so the one that makes me feel good is the one that I keep doing, and the one that makes me feel terrified is the one I keep avoiding. So that's a life out of balance.
Mm-hmm. And sitting with your stuff doesn't require adrenalization, which, as we know, is one of the root addictions that we have with CPTSD, is that intensity to either fight, flight, freeze, or fawn comes, I think, after the fact more, but that motivation to keep ourselves safe, it makes a big protective factor running to your dope dealer's house. It really does.
Listen, and for everybody out there, if you're like, oh, so I just need to be doing energy psychology, listen, if you need to go to inpatient treatment, that is the place you need to go.
Please
We're
do.
not trying to say that there is a way to just magic a chemical addiction. Like, I can't beat your detox and withdrawal symptoms for you. There is no therapist, there's no private practice therapist that I know of that does magic like that. If you need to be removed from your environment and medically supported while you are detoxing from your substance, that's what you need to do.
Yes.
So we're not trying to say that there are certain, there's something we've got that can keep you from like needing to detox medically and get that kind of support. Let's be very clear. And so just a brief aside, not an aside, a story. I don't want to use the word hopelessly because that would imply that there's no possibility of change. I'm very addicted to coffee. Very addicted to coffee. I try to cut it out and then I go back. I try like harm reduction, whatever. A couple of days ago, I was walking to the farmer's market and I was like, I am so confused as to why this like problem isn't moving for me. Why am I having such a hard time? And I'm like kind of asking myself this question. And then the answer came, which was, I don't know how to be good. Yeah, you know what I'm talking about. So there's some child, whatever age that was, I'm guessing around like infancy, 3, 4, is me going, I don't know how to be good, right? So now I have to go sit with that pain instead of trying to like control the like number of milligrams of caffeine I have in a day. That's what we talk about when we're talking about turning to the internal source. I don't feel sad to share that with you guys, but you just heard Tab go, because that's the root pain is I don't know how to be good. Why am I confused? It's not because I can't figure out how to crack the code of my caffeine addiction. It's because there's some part of me that's like, no matter what I do, it is not good. I am not good enough. I have not cracked the code on how to be good.
Yeah, and it was the code that was given to us by our caregivers.
That's right.
We haven't cracked that one. How can I be acceptable?
If the rules are always changing.
Right.
Right. And so then, and this is just more like the juicy peach that we all talk about with each other all the time. Why is energy or somatic healing better for trauma or addictions treatment than traditional talk therapy?
It's just a small question.
Tiny little thing.
Oh, we just
Let's see,
laugh
how
and
the
laugh
time
and
flies.
laugh. All right. What are your thoughts?
I'll tell. I had mentioned earlier that I do a lot of medical legal work.
Yeah.
And so, as you can imagine, some of that is personal injury. And many of the personal injury cases relate to PTSD. And what I can say is that I've had the utter misfortune of reading thousands of pages of progress notes. They probably should be called lack of progress notes, but
that doesn't mean dick.
whatever. But they were people who received a legitimate trauma, who developed symptoms of PTSD. Whether it was complex or simple, still, the symptoms were really miserable, and they still are by the time this is acquired. And there are obviously secondary gains from lawsuits and all. I'm not minimizing that part, but I read these progress notes, and it's years of weekly treatment with CBT, and they say validated feelings, taught deep breathing techniques, and the person never changes year after year after year. And I know, because I've seen people with equally severe symptoms, if I used AIT with them or EMDR with them, they would be better before they walked out of the office that day, or at least within 2 or 3 sessions.
Experiencing symptom reduction.
And it's like unbelievable that they never get referred for trauma-based therapy. And that's my database, in addition to a long period of time practicing more traditional therapy types. That's my base to say, the beliefs alone just don't get it. You got to get to the energy, you got to get to the emotions, you've got to get to these other pieces to get it to move.
Yeah.
Yeah.
100%. And I mean, the way I would frame that, what you're saying is that trauma fragments it's what it does. And so talk therapy, while it can be very helpful for gaining insight and learning skills. I mean, there's a lot of benefit there, but if you want to be healed, not just learn how to cope, then we need something else, because the fragments don't come all the way together. And what the two things we've been talking about primarily here, EMDR and AIT, do is bridge your thinking, right, with the feeling, meaning sensation.
Yes, not just putting a word on it,
right,
but like what you're sensing and feeling in your body.
Right. And so you might have the emotion of sad, but you sense a clutch in your throat, right? That knot in your throat. So combining the thinking, the feeling with an intentional statement that is adaptive.
Right.
And moving it through your body. People say, I can feel that. Oh my gosh, my shoulders are gone, or my ear is ringing right now. Those secondary sensations you were talking about. And people can track them out of their body, and when they're done, sometimes they're a little disoriented.
Yes.
Right? Like, I gotta sit here for a minute.
You get a little trancy with either one of those treatments.
Yes, absolutely.
Which is cool, but
And I mean, a lot of times people are blissed out, even if they know that they're going back to the same problems in their day-to-day life, they feel better.
Yeah.
And I really think that has a lot to do first with just getting the negative electrical charge out of the body, but also now we've got oxytocin. Right, now we've got some hormones flowing.
Right.
That's how I would say it, is that we're fractured, and so energy work puts it all back together.
I would just also say, my sense is that when the memory is originally encoded from the trauma, it is attached to whatever emotional state was at the trauma.
Yes.
And what EMDR and AIT and probably EFT and a whole bunch of other initial treatments do is that they separate that emotion from the memory.
Yep.
So you can keep the memory, you can learn what you need to learn if there's something to learn from it, but you no longer get the emotional activation from it, and that is life transforming.
Yes.
Because that's how it is that your client that you did the write-up on lost the diagnosis of PTSD.
Yep,
that's right,
exactly.
And that is so core, is separating emotions from memories, and these techniques do that.
They do. I mean, I think the most common comment I get when I ask what's changed, right, is that people say, I feel further away from it.
Yes.
I am not my shame in this memory. I felt shame. Oh, I felt shame because the immature, under-resourced adults in this memory were transmitting their low self-esteem onto me, not because I am my shame.
Right.
Right. I'm separate enough from that emotion to go, it would make a lot of sense that a 4-year-old would feel that way. And I don't want to treat myself that way anymore today. What a difference.
Huge.
Right.
Huge.
I'll add that again, if we talk about this idea that like our own behavior is inscrutable to us when we're talking about addictive behavior, did I want to go into an Instagram K-hole, rabbit hole for like 3 hours? No. Where did I go? Into that. Oh God, cue the shame. But so when our behavior is inscrutable to our logic, our ego, okay? This part of us is not, it's a sharp tool, it's not transformative. And so if I'm really good at performing and hiding my emotional life, you know where I'm gonna feel real good for about an hour a week? In my CBT therapist's office. They're gonna be like, maybe think about it this way, and I'll go, ooh, I will. And then they're gonna go like, maybe if you did this, you can change this behavior. And I'm like, I will.
Right here are my notes.
That's good, I'll do it. What's my homework? This worksheet, I'll do it. But if you not make me, if you can create a container for me to sit in my body, and then what's in my left hip is rage like I didn't even know was there.
Yeah.
That's what needs treatment, not to use my ego, my intellect, this protector part to engage from the forehead up.
Yeah.
And so, you know, you can feel good in an hour because someone's like, sounds like you're really doing your best. And you're like, But again, it's that like 12-year-old part of you that knows how to go to school and get A's. Or like knows how to impress the adults around you because you're going to a lot of adult parties because your parents don't like get you babysitters, you know, like so
where I learned I like cream in my coffee.
Yeah, man. So for me, when I think about why energy healing or why somatic therapy versus talking is because I can spin a yarn for you from up here. But if I have to sit with myself, I've said this on our podcast before, I spent 6 months in EMDR before I felt any somatic sensations below the neck. It took me 6 months of like dogged work and a lot of belief. Like faith. I have faith in this process. I have faith in this. And then finally,
I was bad.
No,
Wow.
Greg, it's me.
I'll
get the
both.
dissociation
Wow.
award. And then finally what happened was this sensation of like this hard peach pit in my heart, in my chest, that blossomed into heartache, that now I can tell you like what I feel in my body when I feel a certain emotion. And that's because for all the years that I had gone to talk therapy and someone had been like, well, here's a way to look at this differently. And that's helpful. I'm not here to say that that isn't helpful. But if you spent, I don't know, 6 months doing AIT and then wanted to go talk to a talk therapist, your nervous system would probably be soothed enough that you could get something out of that talk therapy. Whereas if you're totally activated from here down and you can't feel it, sorry, when I say from here down, if you're just listening, I'm talking about from the neck down, where that big old brain is like, I got all of it. I can solve the problems. I can handle everything. Look no further within. I'm the one with the answers. I just gotta figure it out. Just gotta crack the code. Intellect is a sharp tool, but it's not transformative. Whereas there's a part of you that knows what you need for healing. And listen, using ideomotor cueing to bypass that intellect is the greatest tool I have ever received as a mental health clinician in my professional life.
Fantastic.
Cool.
It's a good one.
It's a pretty good one. And then you can learn how to do it for yourself if you're out there.
And then it becomes a lifestyle.
That's right. And I'm talking about muscle testing, folks. And you can buy the book Emotion Code by Dr. Bradley Nelson, where he talks a lot about releasing trapped emotions in yourself. And he talks about how to teach yourself how to muscle test yourself. Essentially, the idea here is that you can bypass that intellect that loves to try and give you misinformation in under the guise of figuring it out. And you can get down to some deeper part of you, your deepest, wisest self or your highest self, that's like, I know what you need, and if you can get still enough and listen to me, I'll show you what it is.
I just have to say one thing because I can't contain myself.
Go on.
And that is, I like muscle testing to a degree.
Go on, Greg.
But I just like to tell people, because the conception of muscle testing tells you what's true and what's not true.
Right.
Yeah.
It is not a true-false measure.
It's not a lie detector. You can't go running around trying to find out if people are lying to you.
You can, and you can't test whether you're going to win the lottery next week.
That's
either.
right. That's right.
Think of it as a measure of congruence.
That's
Yes.
So that your conscious mind is saying, oh, I'd really love to lose some weight, but then you never do. If you muscle test that and it comes weak, it suggests there's a part of you that doesn't want to do that.
That's right.
And that's what gives you the sense of a mismatch between different layers of your being. It's not just a true-false test. And a lot of people treat muscle testing as if it's a true-false test. And I think that's just not quite the right way to look at it.
Mm-hmm.
Or let's say that you will, if you try to use it that way, which I certainly have in my young career and on myself, you'll pay the price for it because you're not getting good information. And then you're like, why aren't things working out the way that my magic crystal ball told me they would? Yeah, newsflash. It's what he's talking about. It's not the other way.
Yeah. And that is all true.
It's like that, yeah.
I would just like to also add my dire warning about muscle testing, which I practice. I do energy testing for myself. If you're with a clinician who will usurp what you believe to be true for their muscle testing result, that is not a good environment.
Yeah.
Yes.
It's more of what
That
you
is
already had. And yes,
Yeah.
absolutely.
Yeah.
So just be aware that if you do find somebody you work with that practices muscle testing, they still need to defer to what you believe and how you feel. And I would even say your languaging, but we don't have to get into that.
Yeah. Okay, so we're coming up on our time, folks. What would you say is like from this conversation, which was about, addiction, your own energy, self-compassion, what's like one thing, Greg gave us a book recommendation, I dropped one in there too. What is like one salient takeaway that if someone was listening to this and they're like, okay, this is all well and good, but where would I start? What could I do today? What are some of the things that not some, one. What is the one thing that you would encourage someone to try or consider, that salient takeaway that we try to leave people with on our podcast? So somewhere to start. Start with you, Tab.
Start with me?
Yeah.
I'm going to go back to the same takeaway I gave during our very first podcast, which is take a pause. When you are feeling compelled to use a substance, eat a brownie, go to the gym twice in one day, whatever your thing is,
Right.
just take a pause and notice what you're feeling, sensation-wise. Just notice what's going on with you. And if you still need to eat the brownie or go to the gym or work that extra hour, you have permission to do that. Just be more aware while you're doing it.
Yeah.
This is called harm reduction, right? Instead of abstinence. No brownies ever. I don't even eat brownies. I don't know why I'm on that. But blondies, I'm a sucker for.
Okay, so
Okay.
yeah, like taking that pause and that your life is not about you're worth so much more than just controlling your behavior. You deserve so much more in your life than that. All right, Greg, what about you? What's like one thing that you would encourage someone to try this week or consider or take away?
As you said, sit down, be still for a moment, and instead of thinking about all the reasons that this substance or this behavior is hurting you or why you want to stop, close all of those windows in your head and instead ask yourself, how is this behavior or substance supporting me and serving me right now? Because once you discover even the tiniest inkling of how it's supportive to you, you can replace it with something else when you're ready.
Yep.
And I will say to you that the opposite of addiction is connection. It's not abstinence. And I often ask my clients to consider that early recovery or anything of that nature it's like a Fabergé egg, okay? I'm not gonna let any old body handle that priceless artifact. If you have to move the Fabergé egg from like one place in a museum to another museum, you choose with care the person who's gonna do that handling. What I'm getting at is you deserve support, you need it. Keep looking for the kind of people who are going to give you the non-judgmental support that you deserve while you're on this journey. For every person that's like, why don't you just do what I do and not do that? There's gonna be someone who's like, that sounds hard. It sometimes takes a little bit to find them, but an ACA meeting, Adult Children of Alcoholics and Family Dysfunction, is a great place to consider. Listen, there are AA meetings where people are really nice. And so in the 1930s is a very big difference to 2022, where there are, like, community and social support is what you deserve while you're considering what you might want to change in your life. And so keep an open mind to where those supports are. We have a Facebook group for the CPTSD podcast. And so keep looking for that community and that support, that self-compassion too, treating yourself like you deserve to be cared for well by other people. You can find me at Beth at the CPTSD podcast. You can find Tab at the CPTSD podcast. And if you've got like some sort of big juicy topic you want for us to cover, you can send it to admin at the CPTSD podcast. And then where would folks find you, Greg, if they wanted to learn more about you?
Probably the easiest thing is just to go to my general website. It's www.gregorypbrownmd.com. So pretty much just my name.
Veritable and venerable Dr. Greg Brown.
Yeah. And I can't help it, but I need to throw one more tip.
Come on.
Out there. All right. If you are struggling and suffering with a chemical dependency, as Beth was saying earlier, please get yourself the treatment that you deserve, either through detox or some type of rehab. But there are also outpatient clinics in your area, I'm almost certain, that can offer you medication-assisted treatment for alcohol and opioid use.
Oh, that's right.
And I really encourage you to consider using that to support your recovery, because statistics show there are better results remaining clean and sober through MAT.
That's right.
And it may save your life.
That's right. Thank you guys so much for being here. This was so much fun. And maybe we'll get Greg back, and it might be on Zoom. That really gives me the blues. But maybe we can have Dr. Brown back again for another podcast soon in the future.
Anytime.
Thank you so much for being here. Thank you guys all for being here and listening.
Take it easy.
Bye.